Good day, dear friends. I am Dr Manjusha Goel, lead consultant, CK Birla Hospital. Today we are going to discuss about uterine fibroids. Uterine fibroids are commonly also called uterine leiomyomas, and they are the most common gynecological problem any lady may have. They are usually the benign growth of uterus, and they depend on estrogen and progesterone for their growth. That is why they are most commonly seen in childbearing age and perimenopausal time, and after menopause usually they shrink or calcify as they won't get hormones. So they can be one or multiple, and they can be depending on their positions, like they have different positions in uterus. Some may be intramural, that is when they are in the wall of the muscles of the uterus. Then few can be inside the endometrial cavity types, and they are the submucous types, and some may be outside under the serosas or outside serosa, subserosal types. So practically the ones which are disturbing the endometrial cavity, submucous type, may just present with the infertility. There may be a difficulty in conception, and the most common types intramural, their ladies will present as the heavy menstrual bleeding, and in submucous serosal type usually no symptoms may be there. So usually they do not develop into cancer. So it is very rare for them to be associated with increased malignancy. Just diagnosing a uterine fibroid should not alarm us for that, and if we are under doctor's supervision, so there is no reason that once we are diagnosed with a fibroid we need to get it removed. Now, what are the various causes for this are just not known to us, but there are some risk factors which may be associated, like family history, polycystic ovarian disease, some races, black and African women have it more, diabetes, alcoholism, obesity. So few we can take care, few we can't. And then there are the symptoms. Symptoms are like we have already discussed, a lady may present with heavy bleeding, for not conceiving, infertility, or maybe a pressure symptom of heavy urination, frequent urination, and then pain abdomen may be another symptom, pain during sex may be a symptom, leg ache or backache. How to diagnose them? For diagnosing them, ultrasound is the best modality. Once your doctor suspects, they can go for ultrasound, and it can tell us the place of the fibroid and number of fibroids. All those things can be seen. Then sometime we do CBC to find out actually anemia associated with fibroids. Another diagnostic modality, MRI, may be used, but it may or may not be that required. And another thing is hysteroscopy to see the submucous fibroid. As for the medication part or treatment part of the fibroid is concerned, there can be medical treatment, there can be surgical treatment. For medical treatment, we can put a patient on tranexamic acid during periods if she is having heavy periods, and with supplement of iron and other things for the iron anemia treatment. And oral contraceptive pills can also be used to regulate it. Then NSAIDs, painkillers, which can be given for alleviating the pain of the female. And another thing, we can use there are medications which can shrink fibroid, but they won't remove the fibroids. They can also be tried. GnRH and agonist type of drugs can be used. Levonorgestrel containing IUCDs, these are Mirena types, multi-load copper T type devices, but they have hormones on their stems, and they can be used to help us in decreasing the bleeding during the periods. Then the surgical method. Surgical method is hysterectomy is one choice, where childbearing age is complete and the fibroids are big and they are symptomatic. Then getting removal of the uterus will help us in completely curing the case. And then other thing is myomectomy. Myomectomy is used for the childbearing age females where only fibroids are removed. Then MRI guided ultrasound surgeries can be done. And another thing is uterine artery embolization. So do not be afraid of seeing a fibroid. Sometimes they need treatment, sometimes majority they do not need treatment. Just be in touch with your doctor. Thank you.